So all of the justifications given for this vaccine mandate really make no sense whatsoever from a health perspective. And one can only conclude that the requirement was politically motivated. The White House has just announced the end of the COVID-19 vaccination requirement for international travelers. This comes very, very late in the day, and frankly, it's a requirement that had no justification at any point. Test data from the United Kingdom and Denmark as early as January 2022 showed that people showing up at test centers were testing for COVID in equal numbers proportionately, whether they were vaccinated or unvaccinated. So the argument that this requirement, this COVID vaccine requirement for travelers, helped to reduce the spread of the virus or reduce the spread of new variants is just nonsense. It has no basis in evidence. We know that the protective effect of the vaccines, insofar as there is a protective effect, is short-lived, maybe a few months. And we know that the vast majority of COVID hospitalizations were in people with serious underlying health conditions, such as obesity and heart disease. So the argument that you would be protecting people's own health by imposing this requirement is also nonsense, since an indiscriminate requirement would be imposing the vaccine on many, many people who were at extremely low risk from COVID, in particular young and healthy people. So all of the justifications given for this vaccine mandate really make no sense whatsoever from a health perspective. And one can only conclude that the requirement was politically motivated. Now, there's one final aspect that is extremely troubling about this vaccine requirement, which is that the COVID vaccines have known risks, known recognized risks, such as myocarditis. And to impose a medication systematically on a population that has known risks, significant known risks, is to prevent people from making an appropriate risk-benefit assessment of a drug that they're about to ingest. This is essentially an attack on people's bodily integrity, an attack on people's right to make their own informed health choices, an attack on informed consent. And it's very troubling that one of the leading powers of this world, the United States, would be quite happy to have a requirement like that for international travelers. So it's a huge relief, and I'm happy to see this requirement go out the window. But it's also a great shame and a blemish on the US Biden administration and on the CDC that they implemented such a requirement in the first place and kept it in place for such a long time, disrupting the lives of travelers, removing their informed consent to medication, imposing unnecessary health risks on them, all in the name of public health. So my view on this is that it has little to do with public health and a lot more to do with politics. And when something strange happens in politics that makes no sense from a rational perspective, what you have to do is follow the money and see who stands to gain from such an absurd policy. So who stands to gain from a policy that requires all travelers entering the United States to take a medication? I'll leave that for you to decide.